Hi everyone, Dr. Michelle Mian here. What we're going to go over right now is the concept of overbite. Okay, so let's talk about overbites. We have two examples right here. On this side, we see what's called a deep overbite, where we don't see any of the lower front teeth, we just see the gums right there. Now if we look on the other side here, we see the gap between the top and the bottom front teeth, and this is called an open bite. This is the way we ideally want our teeth to fit together. If I draw a blue line where the top front teeth are, and a blue line where the bottom front teeth are, we see that there's an overlap. Ideally, we want 20 to 30% of that lower front tooth overlapped by the top front tooth. So this is an ideal overbite, to contrast to the deep bite and the open bite that I just showed you. Now I want to show you what that looks like from the side. We were just looking from the front. So if we zoom in on the nose and the lip area, this blue line is going to denote the top front tooth. This blue line denotes the bottom front tooth. And there we see the overlap of the top and the bottom front teeth. Again, that's called our overbite. Now, if we had the top front teeth right here and the bottom front teeth right here with that gap between the top and the bottom front teeth, no overlap, this would be called the open bite, like we saw at the beginning. Now, there are several risks of having an open bite. One is that we're biting harder on our back teeth because our front teeth aren't touching or coming together. So over time, that's going to cause some wear and tear of those back teeth. Now, additionally, if you want to bite into an apple or bite into a piece of meat, your front teeth aren't coming together for you to have that nice sharp edge to bite into. So sometimes people complain of difficulty chewing. Now, if we're to look at the other scenario, these are the top front teeth and these are the bottom front teeth, and they're almost completely overlapping with our deep overbite, we have several other risks here as well. So these lower front teeth can end up actually biting on the top of your mouth, and you can start to have trauma on your palate or the top of your mouth. What happens over time when we have a deep bite typically is these lower front teeth also get crowded. Now, when crowding happens, it's more difficult to clean around them, to brush, to floss. Plaque and then calculus can build up around these teeth and cause gum disease, where that's inflammation of the gums and loss of the bone, and that's something we want to try to avoid. Now, what that looks like is something like this. So we can see all this plaque and calculus build up around these teeth, and that causes inflammation around the tissues. Now, overbites are quite common. In fact, we see many famous actresses have it. But luckily, this was before her treatment, this was after, you can see her bites improved. Luckily, there are several different treatment modalities for deep bites and open bites. We can use appliances, we can use braces, we can use Invisalign. Invisalign actually works quite well with open bites. But it depends on every case, and a consultation is needed to determine the proper treatment modality for yourself.